Our planet Earth is sick. Planetary Health Action for Awareness, Resiliency, and Sustainability. The natural environment makes development on our planet possible. However, waste, misuse, and carelessness towards natural resources by man have impacted people's quality of life and generated a multitude of environmental problems. Increasingly, it is necessary to think about our present and our future generations. We have been trained in human health. How adequately trained are we in planetary health and One Health? Protecting the planet protects us. There is urgency to protect the planet. How can we help? It has been determined that family physicians are the best suited to advocate and raise awareness of planetary health. But how aware are family physicians of planetary health and its importance to life and livelihood? A situational analysis, research study, was conducted in 2021 between the University of the West Indies, St. Augustine, Trinidad, Department of Paraclinical Sciences, Faculty of Medical Sciences. Dr. Sandeep Maharaj, T. Forbes, T. Guerra, T. Kanhai, T. McGregor, T. Seals, T. Rattan, and the Caribbean College of Family Physicians. Prof. Marvin Reed, Dr. Paula Henry, Dr. Aldyth Buckland on planetary health knowledge, attitude and practice of Caribbean physicians of the Caribbean College of Family Physicians, their knowledge of planetary health, their ability to implement planetary health concepts in their practice, and the challenges that may impede implementation. Research study discussion. Due to low responses and completion rates of our study's survey, it was difficult to make generalizations and directly assess family physicians' prior knowledge regarding planetary health. 100% respondents indicated that they believed climate change, a major constituent of planetary health, is real, and a majority believe that climate change affects human health. Family physicians show an overall favorable attitude towards their roles in the implementation of planetary health-oriented treatments and practices. Family physicians confirmed numerous challenges hindered the implementation of the planetary health practices, such as patient hesitancy to adapt to more sustainable treatment plans. Research study conclusion, gap analysis. Data collection based on our sample size has revealed that there is a need for family physicians, general practitioners, and other healthcare professionals to discuss the importance of planetary health. Main issues in implementing planetary health were poor adherence to planetary health-oriented treatments, a lack of time during consultations, a lack of support from the government and colleagues and patients' disinterest in discussing planetary health. Continuing medical education and seminars are required to encourage family physicians to implement planetary health policies in their practice. Planetary health strategies to raise awareness, resiliency, and sustainability. Continued medical education on planetary health/One Health plan to restore biodiversity. Topics for awareness and action. Land. Protect wild areas. Farming. Make better for nature. Cities. Make space for nature. Oceans. Protect marine habitats, water, safeguard rivers and lakes for wildlife. Climate. Reduce impacts on climate change. Food, plant-based diet. Reduce waste. One Health collaborate and manage whole environments to aid health. Plan on areas of planetary health behavior and change. Prescriptions for planetary health behavior and change. This can be done through shared storytelling and in social media. The following talking points bring awareness to planetary health lifestyle changes that we can practice with patients. Urgent and transformative actions are needed now to protect present and future generations. Template RX. 1. Reconnecting with community, with nature, with green spaces. 1. Transport. Active transport, public transport, reduce flying. 1. Food, eat plants, local consumption, reduce waste. 1. Energy, clean energy, reduce use, redesign systems. 1. Consumption, fix what you have, buy less, buy ethical, recycle. 1. Equity and Justice, Racial, Gender, Social. Clinicians for Planetary Health, July 2020. Planetary Health and the Practitioner. Reimagining our practice. Protecting nature to protect ourselves is an urgent call to action. 1. Teach patients to think on purpose. Is my activity safe for me, safe for you, safe for the community, safe for the environment? 1. Teach respectful relationships with all. God, self, other family and community, animals, plants, environment. 1. Greening our practice. A. Assess your current environmental impact. Identify the key areas of your practice that contribute most to environmental strain, such as energy use, water consumption, waste generation, and purchasing habits. B. Set clear and measurable goals. Define what you want to achieve, such as reducing paper waste by a specific percentage, increasing recycling rates, or decreasing energy consumption by a certain amount. C. Implement sustainable purchasing. Choose to buy products that are environmentally friendly, recyclable, and locally sourced so as to support sustainable supply chains. D. Improve waste management. Focus on the principles of waste reduction, reuse, recycling to divert waste from landfills and promote a circular economy. Enhance energy efficiency. Invest in energy-efficient equipment, utilize renewable energy sources, and promote energy-saving behaviors to reduce your carbon footprint. F. Incorporate green infrastructure. Include natural landscaping to improve air quality and biodiversity. Avoid artificial turf, which is harmful to people and the environment. G. Educate and engage stakeholders. Inform employees, customers, or community members about your green initiatives and encourage their participation and support for these efforts. Monitor progress and adapt. Regularly review your green practices to track progress, identify new opportunities, and make adjustments as needed to ensure continuous improvement. 1. What is patients' current Sustainable Development Goal, SDG status? Relevance, rewards, wall/social poster. Think in terms of donate what you don't use, SDG 1, no poverty. B. Waste less food and support local farmers, SDG 2, zero hunger. C. Vaccinate your family, SDG 3, good health and well-being. D. Help educate the children in your community, SDG 4, quality education. E. Empower women and girls to ensure their equal rights, SDG 5, gender equality. F. Avoid wasting water, SDG 6, clean water and sanitation. G. Use only energy-efficient appliances and light bulbs, SDG 7, affordable and clean energy. H. Create job opportunities for youth, SDG 8, decent work and economic growth. I. Fund projects that provide basic infrastructure, SDG 9, industry, innovation infrastructure. J. Support the marginalized and disadvantaged, SDG 10, reduced inequalities. K. Bike, walk or use public transportation, SDG 11, sustainable cities and communities. L. Recycle paper, plastic, glass, aluminum, SDG 12, responsible consumption and production. M. Act now to stop global warming, SDG 13, climate action. N. Avoid plastic bags to keep the oceans clean, SDG 14, life below water. O. Plant a tree and help protect the environment, SDG 15, life on land. P. Stand up for human rights, SDG 16, peace, justice, and strong institutions. Q. Lobby your government to boost development financing, SDG 17, partnerships. 1. Disaster preparedness and emergency management. Follow the Office of Disaster Preparedness and Emergency Management, Aldyth, Jamaica policy, and guidance for people, pets, livestock. Note: emergency shelters do not take in pets. Training in disaster preparedness and emergency management, Red Cross Jamaica. 1. Practice sepsis prevention and management, infection prevention and control, antimicrobial resistance, stewardship, early sepsis recognition in the community, and early sepsis management by the family doctor. Resource Caribbean Sepsis and AMR Alliance website. 1. Climate change considerations on cause of death certificates. In completing a cause of death certificate, please consider the impacts of climate change on health and death. Please reflect on these 8 scenarios. Name of deceased, age, last seen, died on. Scenario 1. Cause of death. A. Injuries, fatalities, mental health impacts as a consequence of B. Severe weather as a consequence of C. Climate change. Rising temperatures, more extreme weather, rising sea levels, increasing CO2 levels. Scenario 2. Cause of death. Asthma, cardiovascular disease, cancer as a consequence of air pollution, as a consequence of climate change, rising temperatures, more extreme weather, rising sea levels, increasing CO2 levels. Scenario 3. Cause of death. Malaria, dengue, encephalitis, hantavirus, Rift Valley fever, Lyme disease, chikungunya, West Nile virus as a consequence of changes in vector ecology as a consequence of climate change, rising temperatures, more extreme weather, rising sea levels, increasing CO2 levels. Scenario 4. Cause of death. Respiratory allergies, asthma as a consequence of increasing allergens as a consequence of climate change, rising temperatures, more extreme weather, rising sea levels, increasing CO2 levels. Scenario 5. Cause of death. Cholera, cryptosporidiosis, campylobacter, leptospirosis, harmful algal blooms as a consequence of water quality impacts, as a consequence of climate change, rising temperatures, more extreme weather, rising sea levels, increasing CO2 levels. Scenario 6. Cause of death. Malnutrition, diarrheal diseases as a consequence of water and food supply impacts as a consequence of climate change, rising temperatures, more extreme weather, rising sea levels, increasing CO2 levels. Scenario 7. Cause of death. Forced migration, civil conflicts, mental health impacts as a consequence of environmental degradation as a consequence of climate change, rising temperatures, more extreme weather, rising sea levels, increasing CO2 levels. Scenario 8. Cause of death. Heat-related illness and death. Cardiovascular failure as a consequence of extreme heat as a consequence of climate change. Rising temperatures, more extreme weather, rising sea levels, increasing CO2 levels. Yes, climate change impacts health and the cause of death. Climate change is a consideration for cause of death certificates. Summary. This article on planetary health action for awareness, resiliency, and sustainability is a guide to assist us to help our planet to recover so that we can continue to thrive. Indeed, do we sense this urgency to act now?